We study heart failure, and in heart failure we are trying to study the role of immune system. Immune system is a very integral part of our body. It helps us fight infections, fight pathogens, germs. It also helps us heal our wounds. If we get a wound on our skin, it's the immune system that helps us heal it within 10 to 14 days. Heart failure also starts as a wound. The question that we are trying to answer is, if our immune system is able to heal wounds on our skin, why is it not able to heal wounds on our heart? And in that immune system, we are focusing on T cells, which are also a big part of our immune system. They are the ones who go and kill those pathogens. And we are trying to see how and why these T cells go bad, something that I like to call as a frustrated response, and why these T cells have a frustrated response, and instead of healing the heart, why do they end up doing more damage to the heart? And that's what leads to heart failure. This drug, if it makes its way to the clinical trials, it's going to save millions of patients who die every year. This is a dream. If I'm able to take it to humans, I think this is what any scientist would want, and this is what I want to do in my career, and this is the only thing I want to do in my career, get something that can make a difference in the lives of our heart failure patients.
I think the main innovation of our research is the developing of the flexible biointegrated type of biochemical sensors. So, our body contains hundreds or thousands of different types of biomarkers. So each of them might carry vital information about our health status. So we believe that the innovation in both the electronics and the biochemical interfaces can help people with chronic brain injuries and other type of diseases. So we hope we can leverage our expertise in material science to help people with brain diseases. And then I am also a member of the chronic brain injury program at OSU. So here we are having a lot of collaborators in neuroscience, and then we aim to bring our expertise together and work together as a team to tackle grand societal challenges. OSU have been providing a lot of mentoring programs and seed grants so that we can use them to support some novel ideas for development of sensor prototypes. At this point, we are still doing these fundamental studies to investigate the devices, investigate the interfaces, but hopefully, one day we can really deliver mature products to help people with health issues.
My innovation is in the use of electricity to make molecules or recycle chemical wastes, but applying electricity to organic chemistry and eliminating toxic reagents, explosive reagents, really pyrophoric reagents by simply turning a switch on and running electricity through a system. So the focus of my research is in using electricity to either store it in grid-scale devices, so we make organic batteries, or to use electricity to upcycle materials, recycle wastes, make new plastics with new properties that people can't currently access, or to make new organic molecules that can be used for pharmaceuticals or agrochemicals, but do it in a very inexpensive way, again, using renewable energies. The lasting impact of this innovation, I hope, is that it will change the way that we make molecules, and in particular, change the way that pharma makes molecules so that they can more readily develop molecules that can directly lead to optimized drugs, and with these lower costs in synthesizing these derivatives, hopefully that then translates to the end user and the consumer. So that's for one thing. The other is for the plastics. We want to develop systems that can take PVCs and give us complete control over these materials. Control in the sense of making it as long-lived as we want, but also allowing us to break it down when we want so that we can discard it and reuse it in particular ways.